All right, should we get started? I'll let people in as they arrive. So hello, everyone. Welcome to the November edition of the IGRI Research Seminar Series. It's good to see everyone. And in case you don't know me, my name is Uta Brady. Does everybody know me here? I think so. Visiting scholar at Arizona State University, IGRI's associate director. I organize these seminars. And actually, we had, due to an illness, we don't have anybody presenting in December. So if you know someone who has a research project that's IG related, send them to me. Or if you wanted to present in December, we have a slot opening. So yeah, that would be great. Now, today we're going to be welcoming Aaron Lien. He was an associate professor at University of Arizona. Sorry, almost made you a sun devil. Almost made the kitty a sun devil. He'll be presenting the work that he's conducted in collaboration with his colleagues Liz Baldwin and Tom Evans, using the IG to assess the effectiveness of non-pharmaceutical interventions, NPIs, particularly social distancing policies to reduce the transmission of COVID-19. So I'm not going to talk anymore. I'm just going to give the floor to Aaron. But Aaron did request that if you have any questions to go ahead and interrupt him or put it in chat and I'll interrupt him.
Yeah, it's very hard to manage chat when you're giving presentations on Zoom, as I'm sure you all know. So if someone could either just speak up or let me know, and feel free to interrupt anytime. I'm an assistant professor at the U of A, so I'll take the promotion that Uta gave me to an associate professor, but still an assistant professor right now. And I'm going to be talking about our project to develop this national database of NPIs, so non-pharmaceutical interventions for COVID-19. Most of what I'm going to be talking about is going to be about the data collection process and how we've gone through coding all of this. We have a huge database, as you'll see, and it's taken quite a bit of work to get to the point where we are now. And we're just getting into the data analysis phase here. So we have some, I'll show some of the kind of preliminary stuff that we've just been starting to look at here, but I would also love to get feedback from folks, like yourselves that are experts in IGT and institutional analysis on different directions we might take with some of this. And we're also starting to think about new approaches we might be able to take that kind of hopefully will make some of what we've been doing a little bit easier in the future. So I'll talk about some of that as well. So just to start out with, first I want to acknowledge all of the collaborators on this project. It's been a big effort and there's been a lot of people involved. So it's certainly not just me. Tom Evans at the School of Geography here, I'm sure many of you know Tom. He was the person who was able to get us started because he had some money from an NSF Rapid to support getting this work going. And then we pulled together a large group of faculty here at U of A from different departments that have been able to help us pull together this work, think about the best approaches to collecting data about COVID policy and how to structure that data in a way that'll be useful as we move ahead for combining things with epidemiological data to be able to say something about the effects of policy on COVID outcomes. So Annie Bostad at the School of Government and Public Policy, Liz Baldwin in our School of Government, and Laura Bockinson have all been involved in helping us think about the policy side of things. Leila Barraza and Casey Ernst at our School of Public Health have been involved in helping us think about the public health and epidemiological side of things. Laura McCann and Nupur are our graduate students on the project that have been helping us get the work done and manage all of our undergraduate team. So they've been really essential for making all this work happen. So I just want to acknowledge all of those collaborators right from the beginning. And then an overview of what I'll be talking about today, just give you some background to start and why we're doing this, and then talk about our methods and approach, talk about the database itself and show you some of the data that we have, and then hopefully we'll have a good amount of time available for discussion, and we can talk about approaches to using these sorts of data and places that we might be able to go moving forward. So this project is about COVID and non-pharmaceutical interventions for COVID. When we think about COVID policy or the ways that local governments especially have approached managing the COVID-19 pandemic, they really had two major tools available to them. So we have the education and recommendations that public health departments can make about what you should and shouldn't do, mask wearing, where you can get your vaccines, hand washing, all of these kind of more educational and information sort of things that public health departments have been doing. So that's not really policy, that's more of on the education side of things, but that's been an important tool. This is our Pima County here, where University of Arizona is located, their information page. So you can see the sorts of information that are typically provided by public health departments. And then there's policy interventions. So we've all, experienced some of these policy interventions, especially early on in the pandemic with lockdowns and restaurant closures and all kinds of things that were affecting, and in some cases still are affecting, many different sectors of the economy. And these policy interventions were implemented either at the state or often county level or even city level, and they vary quite a bit. So there's a lot going on here and a lot to know about that we don't know a ton about at this point. So beginning in March 2020 and then going forward, we started collecting systematically all the information we could find about these non-pharmaceutical interventions, these policy interventions to address the COVID-19 pandemic. And the reason we did this is because local and state governments were making policy with really very little information about what the effect of these policies might be, how to design the policies, what combinations of policies would be most effective, would be the right combination for slowing the spread of COVID. So you saw in some places, counties or states, going all in and restricting everything. You saw in other cases, states and counties taking a much lighter touch on how they implemented policy or designed policy. And this is because we just didn't know, and to a large extent still don't know, what the effects of different combinations of policies or different designs of policies are on the spread of COVID-19, what actually works. And this is an evolving thing. So we're learning as we go here from the results of implementation of policy so far on what the effects of those policies are in COVID spread. So what exactly are non-pharmaceutical interventions? So these are things that aren't about vaccination requirements and things like that, which are more of a direct intervention to try to limit the spread of the disease. This is about modifying behavior. So these are policies that are designed to slow or halt the spread of COVID-19 in a community by getting people to do things differently, behave differently, restrict behavior or direct behavior in certain directions. So you can see on the right here, this is an example from our Pima County Health Department that was issued this year for schools. So slowing the spread of COVID in schools. You can see the kind of typical construction here of a policy document. So all the whereas clauses and then the orders following that. So in this case, we have orders that all schools must report positive cases of COVID-19 to the health department. And then once identified, people need to be sent home immediately. So this is an example of an NPI, of a policy that's designed to limit the spread of COVID in schools by mandating certain behaviors of people. We see a ton of diversity in NPIs. These were designed and implemented across all kinds of different sectors of the economy early on, especially in the pandemic, and then certain ones have kind of endured through even now. So as we kind of transition into a post-pandemic world, some of these NPIs in some places remain in effect or have been modified in ways. So some parts of them are still in effect while other parts have been reduced or removed. each economic sector is different, right? So they have different NPI approaches in these sectors. So we have a lot of complexity in these NPIs. If you're going to be restricting behaviors at restaurants, you're going to probably or maybe do something different than if you're restricting behaviors at, say, nail salons or restricting behaviors at retirement homes. So all of these places had different approaches to NPI implementation and design. And so we wanted to understand something about these differences and the effects of those differences. You also had a range of methods that were used for implementation of NPI. So in some cases, these are just kind of advisory statements that are issued by counties or states or public health departments. And sometimes they're recommended, but not required. So you might have a mask recommendation. All people should wear masks in public, or are encouraged to wear masks in public, but not actually required to wear masks. And then in other cases, they are actually required. So these differences in how they're implemented and the deontic of these could matter, probably does matter in their effectiveness, or at least that's something that we would like to understand if it matters, right? And then they're issued at different levels of government also, and these levels of government can be nested within one another, first of all. So we have states and local governments that are sometimes issuing different NPIs. Sometimes those NPIs contradict one another. We have a lot of examples of states trying to limit the powers of local levels of government from implementing their own NPIs. That's certainly something that's occurred quite a lot here in Arizona and in other states that have leadership that wants to kind of limit the effect of COVID on the economy. So, you have those sorts of conflicts happening. You also have NPIs that are issued by different parts of the government, right? So you could have public health departments that are issuing NPIs. You could have executive, county executives or governors issuing NPIs, or they could be coming from the legislative branch. So we need to look in a lot of different places to identify where all these NPIs are coming from, which makes it really complicated to capture everything that's happening in a given state or in a given county at any given time. And so because of all these complexities, our effort is pretty different from other efforts you might have heard about to understand and collect data about NPIs. So first, we're focusing at both the county and the state level. So we're trying to capture variation within states as well as at the state level. Our data is all collected in-house. So there's been a number of efforts to collect NPI data that use crowdsourcing. That crowdsourcing approach can be effective and efficient for getting a lot of data in the door, but the quality control can be pretty poor. And the evenness of the data can be pretty poor. So you'll get a lot of data about certain places and no data about other places. And so we're doing all of our data collection in-house using undergraduate research assistants that we've hired and trained here on campus so that we can have pretty strong quality control and good evenness of data over time and over space. And then also our data are repeated. So we are regularly updating data over time. So we're going back to places that we've already collected NPIs for and coded those NPIs. And a few months later, we go back again and collect any updates and go back again. And so these data are continuous over time. And that really sets, we think, our data set apart from some of the other efforts you may have seen to collect NPI data. So this is our project. We call it RECON, Research on COVID-19 Interventions and Impacts. So there's a few different components to this. There's the NPI database, which I'll be talking about. There's also some work on food security associated with this and how COVID has affected food security at the local level. This website is available to look at. I should have put the URL on here, but if you just Google this, it will come up. So you can look at some of the other work associated with this project. So getting into our methods a little bit more explicitly. So we basically had a three-part process for how we collected these data. First was searching. We need to find the data. So looking for policy documents on county websites, on state websites, in a few cases on city websites as well. And then analyzing these documents, so identifying where in the documents NPIs were located, and then coding out those NPIs. And we used a Qualtrics survey to do this, and transferred, the information contained in a proclamation or whatever the policy document may be, and transfer that into a Qualtrics survey that then we could use to build a database of these data. So I'm going to go over the methods a little bit more explicitly in these 3 steps. So what do our NPIs look like and how do we find them? And then how often are they changing and how do we keep track of this over time? So what do NPIs actually look like? So here's 3 examples, all from kind of different places or doing different things, right? So on your left, this is from Baltimore City. So this is an example of a city that has powers similar to a county. So we included that in our data set. This is to rescind an executive order. So we're not only collecting data on when NPIs were put in place, but also when they ended. So we need to collect both the executive order that put that NPI in place and also the executive order that ended that NPI, and understand what the conditions are on that order rescinding, and does it rescind all NPIs or only certain NPIs, under what conditions, et cetera, et cetera. So that's one example. In the middle here, also from Maryland, is an example of a health department issuing, or I guess this is an emergency services department issuing an NPI. So this relates to restaurants, and you can see the construction here at the beginning in bold here. So this is a county taking action until they get further guidance or more restrictive guidance from the state level. So MDH is the Maryland Department of Health. So this NPI is in effect in Talbot County until a more restrictive guidance is issued by the state. So we need to understand here both what the county is doing and then also what the state level guidance is, because that's going to control what is in effect in Talbot County at any given time. So until the state issues more restrictive guidance, we have this county guidance in place, these county NPIs in place. And then they only end when the state issues more restrictive guidance or a order is issued to repeal this guidance. And then on the right, we have a declaration of state of emergency. So this is another kind of tool that was used by county and state governments to make policy around COVID. So putting in place emergency orders that allowed them to do things that they otherwise wouldn't be able to do. So this gives them the authority to establish policies and protocols defining things related to the state of emergency. So we coded these types of documents so we understood when county and state governments were able to do certain things under their states of emergency. So those are examples of what some NPIs could look like. So a lot of diversity here coming from a lot of different places. So also the one on the right is from the legislative branch, right? So that's the county commissioners issuing that. On the left is the executive branch issuing that. In the middle, you have a department issuing guidance. So you can see some of the diversity that we had to deal with here as we were starting to collect this data and think about how we could code that systematically into a database. The next challenge is actually finding all these data. There's no single place you can go to get these. There's no consistent place even within the structure of county government websites or state government websites where you can be assured of finding all the information about COVID policy. So we had to come up with a pretty extensive search protocol. So you can see this flow chart on the right gives the directions for the undergraduate research assistants to use as they start searching for documents related to NPI. So starting with their jurisdictions that they're assigned to and working through, finding websites. And then they have conditions that they use to make decisions about when, to go one way or another way through their search protocol at various points during the search. And then as they move through here, they're collecting documents, and then as they get those documents, then they move towards coding those documents into Qualtrics and move through the process. We also have the ability for people to go and use things like the Wayback Machine and things like that to try to find data that doesn't exist anymore on county data sites, on county websites, which is a problem. Sometimes when they update new proclamations or new orders or whatever the NPIs may be structured as, they remove the old ones. So we lose those data. So when that happens, we try to, as best we can, go back and try to verify that we have captured all of the data. And that gets to how often these things are changing. So these are not permanent data. Policies are changing early in the pandemic pretty frequently, and then now maybe less frequently, but still changing over time. And when they change, they sometimes disappear. Sometimes they don't. Some counties have pretty good records of what they've done in the past and keep those available publicly, and some don't. So part of this is needing to go back and regularly update our data so that we have a good continuous data set that is accurate across time so that we can understand what the effects of different policy have been over time. And so currently, most of our data are up to date through 2021, and I'll show a map in a little bit that shows you where we've collected data and what the age is on that data. So we're continuously collecting data. So some of our data is more up to date than others. We're trying to implement some different strategies about when we go to places and collect data. So as this current Delta wave is kind of working across the country from the south up through the Mississippi River Valley, now into the kind of west and northern parts of the west, and Montana and Wyoming and those states, we're kind of following that surge across the country. So we expect the counties have made, if they were going to make policy, made policy in response to the surge. And so if we wait a bit until that surge has kind of worked its way through, and we can go back to those counties and collect those data about what they did in response, then we'll be more likely to capture things and not miss policies that were put in place maybe mid-surge if we went right away and looked for those data. So getting into the coding here, so coding was designed based on the IGT here. So we wanted to have a very clear and structured way of understanding what these policies were doing, how these NPIs were implemented. So we had 4 basic components of the IGT included in our coding protocols, and these aren't explicit. So we weren't asking undergraduates to learn how to distinguish attributes from deontics from aims and conditions. Instead, we structured the coding protocol such that they were coding these things without knowing that they were coding these things. So we can go back to our data and look in our database and identify where each of these parts of the policies are, but we didn't have to train the individual coders in how to implement the IGT. So we have attributes, we have deontics, we have aims of policies, and we have the conditions of when those policies are in effect. We did not code or else statements. They're often not explicit in NPIs. Where they are explicit, they're often separated from the portion of the policy document that's putting the policy in place. So you'll have a list of policies, and then later on the document, you might have some consequences associated with not following those policies, and that lack of linkage makes it pretty difficult to code sometimes, or to devise easy ways of coding those data. As we often see in coding policy documents, the or else is often not explicit, right? It's implied or left out, and maybe in a completely different document than what we've collected. So because of some of the complexities around or else statements, we didn't code those explicitly into the database. So these are the sectors that we've coded for. So the first three, stay-at-home orders, states of emergency, and general social distancing, are kind of broad, all-encompassing sort of NPIs. And then all of the rest of these are NPIs that affect specific sectors of the economy. So restaurants, transportation, recreation facilities, personal grooming, et cetera, et cetera. And then you can see underneath each of these, the primary things that we were coding for. So what the effects of the different NPIs are, and how we were breaking those down in the different categories. So on restaurants, we wanted to know how NPIs were affecting basic operations of restaurants. Were they open or closed, or only allowed to do takeout, or only allowed to do outdoor dining, et cetera, et cetera. We wanted to know specifically what rules applied to employees. Were employees required to wear masks? Were they required to follow enhanced sanitation protocols? And then we wanted to know what rules specifically applied to patrons. So employees might be required to wear masks, but patrons might not, for example. So we wanted to know if there were differences there.
Erin?
Yes.
Oh, I'm sorry. I didn't mean to interrupt you. I just had a question before on your last slide, a clarification question.
Yeah.
So when you had, this is a really neat idea of sort of having this be a blind coding, but I was wondering, maybe I missed this, like what are they given like the entire policy and then asked to just sort of identify the various attributes, the various, or are they doing this kind of blind coding on any more specific sort of unit of analysis, like the institutional statement? Like,
yeah, so they're doing it on the institutional statement. So if I back up here a little bit, so they would, collect documents like these from the county websites, and then we have a very specific training protocol that they have gone through, and a coding manual that they use to identify where the institutional statements are in these documents. And it's the institutional statements themselves that they're coding from.
okay,
Yeah.
cool. Thanks. I'm sorry. I think I missed that. Thank you.
I'm not sure that I said it explicitly. So, okay. Are there any other questions at this point? All right. Okay, so so there's the next slide here about code books and training. So, we are dependent on undergraduate coders here. This is a massive amount of data we're talking about here, and I'll show you just how big the data set here is in a minute. But these coders don't have any real coding experience in most cases. They certainly don't have any experience with the IGT or coding policy documents. And so we needed to train them to be able to do this sort of work, to be able to recognize where policy statements or institutional statements were in these documents. So what the difference between a whereas clause is and the actual institutional statement that's implementing the rule, right? So differentiating between those, and being able to accurately follow kind of the rules of the coding, right? That takes a lot of effort. And so we had a lot of training effort that we spent time with our undergraduates to get them up to speed on how to code these things. We have a very detailed training protocol that was followed. We have very detailed coding manual that they use kind of side by side with the Qualtrics survey to code in data, so they know exactly what things mean and what they're supposed to be doing at any given point during the survey to code in data. We have put together a guide to reading legal documents so that students that likely don't have any experience with reading these can help them with identifying the structure and the different components of the documents, and what the things are that are really important and what things are less important. Over time, we developed some FAQs, so repeated questions that came up from our coders We kept track of those and then, kind of tried to learn from that over time so that we could proactively address some of the problems that we experienced early on in this process. And then we also developed a management structure for this that kind of allowed us to, we think, keep a pretty good handle on things while also managing everybody's time involved. So we had our core group of PIs, which is Tom and Liz and Annie and I primarily. And we worked with the graduate students, and then the graduate students work with the undergrads. So the grad students are training the undergrads, we're training the graduate students. The graduate students are filtering up kind of the most important problems and questions to us and decisions that need to be made about modifying the survey early on or modifying some of the training protocols and things like that. And then the graduate students were interfacing directly with the undergrads to kind of manage everybody's time and how we implemented this stuff. So what does this database actually look like then? So what kind of data do we have here? So we've been collecting data for all 50 states. And this includes the special case of phased responses. So some states implemented kind of statewide rules for phasing. So based on incidents of COVID, they worked through different phases of reopening or closing or different sets of NPIs. So we've captured those phasing requirements as well as kind of the more basic NPIs. We're endeavoring to code all 3,100 counties, about or so 3,100 counties, parishes, cities with special jurisdictional powers, like you see, like Baltimore City in Maryland, Virginia cities. There's some other states where cities kind of have powers similar to counties. So capturing all of that. Currently, we've coded about 2,500 counties. So we're still trying to get through everything. It's a lot of data. It's a lot of places to go look for things, but we have a pretty robust data set at this point. We have about 13,000 documents that contain NPIs. So each of these documents contain at least one NPI. Many of them contain several NPIs. So it's not just 13,000 NPIs, it's some multiple of 13,000. And it's a temporal resolution at the daily level. So we've been collecting effective dates as well as repealing when these NPIs are repealed or replaced. So we, with a fair degree of accuracy at the daily level, know what was going on in any given jurisdiction. So when you kind of do all the multiplication here, we have really millions of data points here on any given day for any given set of NPIs for any group of counties in the country. We can tell you something about what was going on with COVID policy, and then we can look at how those policies have evolved over time. So here's a map of our current data collection and the vintage of that data collection. So our goal was to have everything through at least the beginning of 2021. So during the kind of most intensive part of COVID from March of 2020 through the end of the year. And then you can see in many cases we have more recent data than that. So we have the entire Western United States through kind of early 2021. We have the East Coast through kind of mid-spring and then through the Ohio River Valley there. And now we're kind of working to catch up in the South. So the South was coded early on in June and July of 2020, and now we're going back and we're redoing the South again to capture changes that have happened since then. And hopefully we'll be able to work our way through the West, the Mississippi River Valley, there, kind of the central Midwest here over the next few months. There's just a lot of counties in those states, and it takes a long time to get through them. One of the nice things about the West is the counties tend to be geographically larger, so there are fewer counties per state, which helps us get through them a little bit more quickly. But so this is where our data are located. So we can certainly do some cool analyses looking at the West Coast or really even through the Intermountain West. to compare differences in how COVID policies were implemented across these states, which have, some pretty important diversity in terms of kind of rural-urban divide, political leanings. So we can do a lot of, we think, cool stuff there. Same thing with the East Coast. So we have a lot of differences there on urban versus rural, cultural differences, political differences between kind of the Northeast and the Southeast. So we feel pretty good about the data that we have, but we also aren't just sitting and on what we have. We're continuing to collect data, trying to keep this database as up to date as possible as we move ahead. This gives you an idea of what just one component of the survey looks like. The survey is really, really long that the coders use to code in these data, but it's all conditional based on what they see in the NPIs they're coding. So these little green arrows on the side here mean that these are conditional things. So these restaurants will only appear if the NPI that they're coding had information about restaurants in it. So we asked them some preliminary questions about what is this NPI about? And based on those preliminary questions, the survey gives them the appropriate questions to fill in data about what was going on. So these are the 4 categories of restaurants and bars that we coded out. So restaurants in general, bars in general, if there's any special conditions for buffets, and then if there's any special conditions for institutional food service like schools and retirement homes and things like that. And then you can see on the operations side, the types of things that were coded there. So some of these are conditional on, so if you pick closed, none of the others can apply. Takeout only, none of the others can apply. But open limited capacity and open limited hours can both exist together. Outdoor dining only can exist with limited hours or limited capacity. So some of these, you can have different combinations of things on the same line here on restaurants. The last one is also conditional. So if it's opened without restrictions, it's just open. So you can't select that with any of the other options. And so, this gives you an idea for operations. We did similar things with all of the other categories, economic sectors that we were interested in. So just give you an idea of what some of these data look like. So in looking at general behavioral modifications, so these are things like social distancing and mask wearing, and giving you an idea of what is required or recommended in NPIs. And this is just a raw count of NPIs that we have in our database. So there's a few things to look at here. So your top bar graph here is masks required in public. So you can see that there were about 150 NPIs requiring masks to be worn in public. Those could be at the state or the county level in these data. So this isn't breaking things down between state and county. And then there are, something like 20, 25 that are saying that masks are explicitly not required in public. So that's interesting that that there would be NPIs or policy statements that explicitly say that something like that is not required. Those are probably mostly declarations or policies that are repealing previous mask requirements. And then you can see, in all cases, the biggest bar is doesn't mention, right? So this is cases where we have an NPI document, and for every NPI document, we ask them to code these basic things. Does it mention social distancing? Does it mention face masks? In most cases, they don't, right? Because they're about other things. And so if they don't mention those things, they got coded as doesn't mention. And I include this just because it's important that in these cases, we know that these data are not missing, right? This is an important factor in building databases. You want to know both when data is present and when data isn't present. And so if we just had them code yes or no here, and then nothing if there was no mention of face masks, then we wouldn't know that they actually looked for it through the document, right? By actually forcing them to code when something isn't mentioned, we know when data doesn't exist versus when data is missing. And so this is applied throughout all of our data collection, this requirement that they tell us when something isn't there. So you can see also with social distancing, there's much closer, there's a lot more social distancing required, but there's also a lot more recommendations about social distancing. So there's a lot of those things going on together. And then when we get to sanitation protocols, enhanced sanitation protocols, there's actually more of those recommended than required in the data that we have. Going back and looking at those restaurant operations, so I showed you what the survey looks like on this, and then just to show you what some of the results are here. So you can see that the most common MPI for restaurants was takeout only. And then, limited capacity was pretty common, limited hours less so. Outdoor dining only actually wasn't that common in the MPIs that we've collected. And then you can see the number there of open, reopened without restrictions. So basically rescinding policy, but in no way does that, match with, rules requiring that restaurants are takeout only or closed. So you can see in a lot of cases, these MPIs are just kind of being left technically left in place. There's not necessarily explicit rules issued repealing the MPIs, or at least that we've been able to find, but we get to the point where they're not being enforced anymore, or something else is happening. So we don't see a lot of formal orders rescinding NPIs, at least in this case. And then for the restaurant sector, so what was required for employees? And this is getting into kind of breaking things down by Deontic a little bit. So we want to know what NPIs required certain behavior versus recommended behavior for different sectors. So this is employee requirements. So employees required to exercise social distancing or wear face masks or practice enhanced sanitation protocols, or the no data again is just being explicit when an MPI doesn't give data on these conditions. So this is what's required. And then if we look at what is recommended, we see that there's many fewer MPIs that were using a recommended approach for employee requirements at restaurants. So, between required and recommended, pretty big differences here. Very few jurisdictions taking the approach of recommending masking or recommending social distancing versus requiring it in restaurants. And then looking at patrons, so is there a difference between patrons and employees, and is there a difference in how these MPIs were structured, so required versus recommended? We have another category here of avoid accessing, right? So where the government is just asking people not to go to restaurants. Very uncommon, I think in most cases where avoid accessing was the case, they just issued orders to close restaurants. And then, social distancing, face masking, etc. here. So we can see a lot of social distancing, much less in terms of requirements for face masking explicitly for restaurants. And then when we look at the recommended side of things, we actually have more recommendations to avoid going to restaurants versus requirements to avoid going to restaurants. But then again, not a lot of recommended approach for social distancing and masking at restaurants for patrons. We also can see things over time. So if we want to look at how NPIs changed over time, when they were first put in place, when they were rescinded. So this gives, for the Western states, when masks were first required, and the gray bars are urban counties, the yellow bars are rural counties, and then the line is the cumulative total requirement. So you can see that urban counties over time required face masks much more often than rural counties did. And then one more over time snapshot here. So restaurants closed versus state versus county level implementation. So the orange line is when there's a state NPI in place closing restaurants, and the blue line is when there's a county NPI in place closing restaurants. So you can see early in the pandemic, there was a state requirement in Colorado, and then we lose that state requirement, it comes back. It's more likely that this is probably a coding error on our part, that requirement was in place until June, and then dropped down. And then you can see the counties, some counties implemented their own restaurant closure requirements on their own, even when the state was in place, and then some counties retained that over time. So where are we going from here? So that's a basic snapshot of our data and what we've been doing, and some of the things that we can extract out of it. We're still working on our analysis. We've been really focused on data collection here and are really just moving into the data analysis phase. So we're doing some analysis now, pulling out from these data some interesting, or at least what we think is interesting stuff. So we're looking at urban versus rural differences in how NPIs were implemented, when they were implemented, the mechanisms used to implement those, whether they were required or recommended. So what are the differences between rural and urban areas? There's good reason to think that they approach these things differently because of different demographics, different likelihood of community spread and other things. We're looking at policy innovation. So what is the relationship between different places that implement similar or different policies? So can we see evidence of policy innovation happening through comparing where different places are doing different things? We want to know something about the effects of different combinations of policies on COVID outcomes, right? That's the big goal here. What combinations of policies are most effective? Or better stated, if you could pick an ideal combination of policies that would have, a high effect on COVID and the minimal effect on the economy, what would that combination be, right? That's what you would really want in place. You want to limit the spread of COVID as much as you can while limiting the societal disruption as much as you can. And so what combinations of policies seem to have the most promise when we look at these data in combination with epidemiological models? And then we want to know some things about the effects of Deontics on this, right? Does it matter that places are requiring or recommending policy, and does that result in different outcomes? We're also starting to think about how to improve this process of data collection and coding. So, you could see through this whole process, we're relying on undergraduate coders here. This is very much a brute force sort of approach to data collection and coding. And I know several people with this group have been working on, using machine learning and natural language processing to try to be able to do some of these types of things without relying on hand coding completely. And that's some of the things we're also starting to think about. Are there ways that we could collect local policy data through web scraping in an accurate way to limit the burden of data collection? Are there ways we could figure out to do some automated coding of some of these things that is highly accurate, so we can get the data into the database without continually relying on having a small army of undergrads to help us with it. And then I wanted to spend most of this time, although I see I've talked much longer than I meant to, having some discussion with you all about what do you think the interesting questions we could ask with these sorts of data, and how could we figure out this problem of moving past brute force approach to data collection and coding. You all are experts in this probably more than I am, and I would love to, and our team would love to have your feedback on what we could do now that we have this really great, what we think is a really great data set. so I will leave it at that. I just want to give an acknowledgement to NSF for some of our funding. That grant was to Tom, and then to all of our undergraduate coders who were really essential to and remain essential to getting these data into our database and developing this data set for us. That's it.
Thanks, Aaron. Great project. Wow. Any questions? Saba?
Oh,
Saba?
I didn't have my hand up.
Oh,
I was
sorry.
just doing
Okay.
but I do have a question, but it looks like Christopher and Charlie do as well. So I'll cede the floor to them first. Yeah.
Okay. Christopher?
Well, kind of similar to you, Saba, but I have a very brief one, just by intuition, because one of the things that sounds incredibly exciting is to how many iterations did it take you to arrive at the right schema? Like, you know, if you have a standardized schema that you run longitudinal across different counties, different levels of policy applicability and so on, you know, to get a sense how to approach the study of that scale, and, you know, what is the technique and the process you're doing, you're applying in this, to achieve this?
Yeah, I mean, it was, you know, are you asking about how we developed the kind of coding protocols, or are you talking more about the analysis?
Well, I think you're primarily focusing on the coding protocols right now. It looked like more like data collection, building up this database in the first place. So this second part will be, you know, from here on, basically. But how to arrive, how to approach it. Someone else wanted to do something else on, you know, non-COVID related information, but at the similar scale. You know, what's kind of a takeaway you would offer? But perhaps more specifically to your project, you know, how many iterations did it take you? How many states did you need to scout? How many pilots codings did you need to run? And how do you deal with the regress problem, basically, that you have encoded information, but you, in retrospect, you realize, oh, we missed features that we now have encoded since we encountered in the next state and so on. So how did you deal with this kind of process, and the lessons that you learned in this would be really, really interesting, I think.
Yeah, it was certainly an iterative process. So we started with Arizona, encoding our data here, developing the survey, testing it, developing the coding protocol, testing it, working with the graduate students mostly initially to figure things out. So they had a little bit more experience with coding policies and coding IGT. So we could, you know, have them do it and kind of raise questions and problems that they saw, and then we would revise. And so it did take a while. It took us, you know, we started working on this pretty much right at the beginning of the pandemic. And by the end of March, we started working on this. I think it probably took us until May to really have the protocols in place and the survey set up the way we wanted. And even then, there were a few things that we didn't anticipate or didn't get right in the survey. And the way we dealt with those is we actually had our graduate students go back and recode some of those things. So when we had to add elements to the survey, we had to go back and redo those. And I didn't mention, we don't just, you know, find these documents and code them and get rid of them, right? We keep all the documents too. So we have this, you know, the database includes 13,000 documents themselves. So we can always go back and validate the data if we need to, or if we add something or change something, we can go back and recode each document if we need to. Hopefully at this point we won't need to, but we do have the ability to do that. But yeah, it was a long process, and we have started thinking about it. So how could we do this for other types of local policy making, especially for local policy making in response to shocks? And so we are actually working on some proposals to maybe host some workshops on this to try to think about this issue with some other folks that have been thinking about it, not just our group, but, you know, bringing in some other folks to think about this and how we could solve some of these problems.
Charlie, go ahead. Go ahead,
Thanks.
Charlie.
Aaron, first of all, my balloon man behind me is like, wow, great job. Totally for you in the project. It's an amazing project. And yeah, really, really the steps you've taken us through, just it's kind of awe-inspiring what you've done. I think what my point is more of an encouragement than a question. As you may know, with the IGRI network, we've been trying to build what I call a commons-based peer production approach to move the community as a whole forward as we move toward this. And I guess my first point is kind of related to what Christopher just talked about. When you talked about your coding protocols, I know we've had, a colleague that I work with, Seth Fry in UC Davis, has been doing this with undergraduates, and there are probably others here on the call that are doing this kind of thing. And so I wanted to encourage you, when you're ready, to possibly think about putting an open Creative Commons license on your protocols, and consider maybe putting it in the repository, the library that IGRI is creating, because I think we're all going to be learning from each other. And I really liked that approach where you kind of were, coding Deontics and aims, but your students, you had a different way of articulating it to help them kind of get their heads around the coding. So that's one encouragement. And then the other thing is, you're doing longitudinal analysis, you're doing comparative analysis. I think as you move forward, I just want to encourage you too to continue to communicate, what you're doing on the analytics side, because we have this idea of what we call IG analytics, where we're trying to figure out how can you use an IG-based database analytically, and so I'm just encouraging you, I guess, to stay in touch with that too, because there are others here, including Adela, who I've been working with, thinking about that. So great work. I'm excited to see stuff that's coming out of it as you move forward.
Yeah, and it's definitely not our intent to keep all this secret, right? Or just keep it all to ourselves. So yeah,
no, of course, yeah, but but there's also the publishing cycle and all that.
Saba?
Yeah, I guess, Aaron, my question is relating to the question you posed about, how to evaluate this, basically, what types of questions that you could ask. And I guess when you posed that question, what came to my mind was, are there, I guess, what sort of patterns do you see at this stage and in this exploratory stage of reviewing your data as investigatable? And I mean, are there particular challenges that you're observing? And what strikes you at this stage as being of interest?
Yeah, so I showed some of the questions that we've been kind of starting to get at. And so we're working on some initial papers looking at this kind of urban-rural differences, which we think is really important. Liz is working on a policy and innovation paper. I'm working on a paper looking more specifically at the IGT components and the Deontics there. Haven't quite figured out exactly what questions I'm going to be asking there yet. So we can do some work just to see what are the difference between recommended and required policies, and look at a little bit about why that matters, but I'm not exactly sure how to attack that question yet. I'm still thinking about it. And then some of the other things we've been thinking about is, do we see any patterns, in the data? So we've done some initial latent class analysis to try to see if we can see any clustering in the types of municipality, or not municipality, but counties and state governments that are implementing different types of policies, or the relationships between counties and states that are implementing policies. One of the other areas we've been really looking at is this idea of preemption. So we had a lot of preemption going on here with COVID NPIs, right, where states in some cases were restricting county governments from doing what they would normally do for a public health crisis. So like public health for a long time has had a pretty strong tradition that policymaking at the lowest level possible is going to be the best for public health, right? Because it's so dependent on demographics of your community, on knowing what's going on in a local place, that the best level to make public health policy is the local level. And that's kind of been mixed up a bit here and with COVID, where states have been stepping in and restricting local policy making. So we're looking into this idea of preemption and what we can see using some of our data on that as well. So yeah, so those are some of the ideas that we've had about, you know, what we might do to get at these data. You know, at some point soon, hopefully we'll be able to share the data with other people. And once we have the database you know, we've been doing a lot of cleaning of the data and things like that to just get it to where it, you know, it's in a little bit better shape to share with other people. And so at that point, hopefully we'll be able to work with some folks like yourselves to get some interesting questions.
Great. Thank you so much, Aaron. Yeah, it sounds like Christopher.
Based on the explanation, just a final reflection. I just want to share. I was having a sense that, hey, is there perhaps some motivation to think about a policy cleanup afterwards as well? Like, you know, how many of the you implicitly suggested that there are a lot of policies that are latent, you know, floating around. No one will care because there's simply no enforcement. Right? Who cares? They're merely there inform effectively. But you know, perhaps you can see which states are really good or counties are actually good in cleaning up properly. And the ones that aren't, in fact, that would be really interesting to see, because you have this data now and you can just rerun it ideally. I mean, you know, with machine coding, of course, more facilitated, but it'd be really cool to motivate policy cleanup. I think that's anyway.
Yeah, that's a really good idea. And I also wonder, like, are we just not seeing, not observing where policies are repealed, right? So it might just be getting done on the consent agenda of a county board meeting. We're just not seeing it, right?
Yeah, that's right. That's right. Of course.
And it's hard to know. But yeah, I think that could be a really interesting thing, fun thing to look at.
Yeah.
I would be remiss without addressing a question that was emailed to me by somebody who couldn't participate today, and she wanted to know why the term social distancing is being used instead of physical distancing. And I don't know if that's something you can answer.
I mean, we're using it because that's the term that
Right.
appears in policy, right? So if we're asking undergrads to code things and they're reading something and it says social distancing, we want to use the term that's being used.
Right.
And,
but it is really physical distancing is
Yeah.
her point, right?
Yeah.
Right.
Yeah, sure. Yeah.
Okay. Thank you very much for this presentation. That was really great.
Thank
We
you
need-
for having us, even though I'm the only one from our team here. We all really appreciate the opportunity, and hopefully we can, you know, find ways to work together on this or other things in the future.
Right.
Definitely. Thanks so much, Aaron.
All right. That concludes today's session. See you again in December. December 7th is our next seminar. So we'll see you then.